When talking about the menstrual cycle, we really can break it down into two parts: what happens before ovulation and what happens after ovulation. In the beginning, we call that cycle day 1. That marks the first day of full flow bleeding. That's when the lining of the uterus is getting shed. In the ovaries, we have small little resting follicles that hold eggs. Our brain sends a hormone that's going to stimulate one of those follicles to grow and develop. That follicle that holds the egg is going to grow and develop and releases a hormone called estrogen. That estrogen is going to cause the lining of our uterus to thicken. And as that estrogen level rises, it's going to reach a peak, and then that's going to cause our brain to release another hormone that's going to activate that follicle to release the egg, causing ovulation. After ovulation, the follicle that released the egg turned into what we call a corpus luteum cyst. Now, sometimes we hear the word cyst and we think that that's bad or abnormal. And yes, we certainly can have some bothersome cysts in the ovaries, but we also have cysts that serve a purpose, and the corpus luteum cyst releases progesterone. Progesterone is what's going to support that early pregnancy if the egg that was released during ovulation gets fertilized. If that egg does not get fertilized, then that corpus luteum cyst is going to resolve. It's no longer going to make progesterone. Our progesterone level is going to fall, which is then going to cause the lining of our uterus to shed, bringing us back to cycle day 1. In a normal menstrual cycle, the ovary develops and releases an egg. If that egg meets with and is fertilized by sperm, that will land in the uterus and grow into a pregnancy. If that egg is not fertilized by sperm, the lining of the uterus will shed, and that starts the process all over again.